Hey there, so if you're a new parent, you've probably noticed your newborn does one thing a lot. They sneeze. And if you found yourself holding your breath and worrying about every single little achoo, well, you are definitely not alone. So today, we're going to get to the bottom of that newborn sneeze and figure out what's really going on.
This is the question, isn't it? It's whispered in nurseries all over the world. You see your baby, so tiny and new, and they're just sneezing away. Your mind immediately starts racing. Is it a cold? Are they allergic to something? It's a totally fair question to ask.
Well, let me just put your mind at ease right up front. The good news is, in almost every single case, that sneezing is not only normal, it's actually a sign that your baby's body is working exactly the way it's supposed to. It's like a brilliant, built-in feature.
So, let's dig into the why. Why does this reflex, which can seem a little alarming, happen so darn often in newborns? Well, the answer really starts with the incredible journey they've just been on.
I mean, think about this transition for a second. For 9 months, your baby was living in this perfect little bubble. Warm, fluid-filled, totally filtered. They got all their oxygen from the placenta. Then, boom, they arrive in our world. A world that's full of dry air, dust, pet dander, lint, all sorts of stuff they now have to breathe through a teeny tiny nose for the very first time. That is a huge adjustment.
That sneeze is what's called a protective reflex. It's just a fancy way of saying it's an automatic response that has one really important job: to keep their airways clear. So it's not a sign of weakness at all. It's a sign of a really smart, efficient system that's making sure they can breathe easy as they get used to life out here.
And if we kind of zoom in and take a quick tour of a newborn's nose, it makes even more sense. First off, their nasal passages are incredibly tiny. I mean, a single speck of dust or a little drop of milk is enough to irritate them. Second, they're still working on clearing out some leftover amniotic fluid from birth. Third, the lining of their nose is just super sensitive to everything, including temperature changes. And finally, they're going from that super humid womb to the much drier air in your house. All of this makes sneezing the perfect tool for the job.
And here's something else that should help you relax. This doesn't last forever. It's a temporary phase. As you can see here, the sneezing is way more frequent right at the beginning. As their little system adapts and those nasal passages grow, you'll see it drop off pretty significantly. By 2 or 3 months, it's much less common. It's actually a pretty cool way to see just how fast they're developing.
Okay, this is the part I know every parent is waiting for. We know it's usually normal, but how can you be sure? Let's break down a super simple guide for telling the difference between a harmless little sneeze and something that might actually warrant a call to the doctor. This chart is basically your new best friend. Look over here in this first column. If your baby is just sneezing, but they're also eating well, breathing easily, and seem pretty happy and comfortable, you can relax. But if you look at this second column, if the sneezing comes with any of these other things, like a fever, or they're struggling to breathe, or they don't want to eat, that's your cue to pick up the phone. The bottom line is, a sneeze all by itself is rarely the problem. And hey, don't just take my word for it. This note from a pediatrician really drives the point home. Doctors aren't really worried about the sneeze itself. They're looking at the whole picture. How's the baby eating? How's their breathing? Are they active? If all of those big things look good, then a sneeze is just a sneeze.
All right, now for a little rapid-fire Q&A. Let's tackle some of the most common questions that pop into a new parent's head. I'm willing to bet you've probably asked yourself at least one of these. This is the big one, right? Every achoo sounds like the beginning of their first ever cold. Or you start looking around the room wondering, is it the dog? Are they allergic to the cat?
Well, you can take a deep breath, because the answer is almost always no. For newborns, sneezing is a really poor indicator of a cold. And as for allergies, true allergies are actually very uncommon this early in life. It's almost always just their body getting adjusted.
Okay, what about this one? This can feel really specific. You've just finished a feed, or maybe you're in the middle of a diaper change, and bam, achoo! What in the world is going on there? It's actually way simpler than you'd think. It all comes down to simple triggers. A tiny droplet of milk getting in their nose, or sometimes even just the smell, is enough to set it off. And during a diaper change, that sudden rush of cooler air on their skin can trigger the reflex. It's all totally harmless.
It's so natural to want to do something, right? You're a parent, you want to help. So you see the sneezing and you think, should I be using saline drops? Do I need one of those nose sucker things?
Honestly, the best course of action is usually no action at all. You have to remember, that sneeze is their body's tool and it's working perfectly. You really only need to think about saline drops if their nose is so stuffy and visibly blocked that it's making them uncomfortable, especially when they're trying to eat or sleep.
Otherwise, just let their amazing little body do its thing.
So let's zoom out. What's the big picture takeaway from all of this? It's really about shifting your whole perspective, moving away from worry and more towards, well, just enjoying this time.
So here it is, your parent takeaway. First, your job is to observe, not to worry. Second, try to think of that sneeze as their own tiny superpower for keeping their breathing clear. Third, you are now totally equipped with the knowledge of which warning signs actually matter. And most importantly, you can trust in the incredible, built-in process your baby is using to adjust to this big new world.
You know, every little squeak, gurgle, and sneeze is a piece of a fascinating puzzle. And the more you understand about their world, the more that anxiety gets replaced by confidence. That tiny sneeze isn't a red flag. It's just one of the very first chapters in their amazing story. So the real question is, what are you curious to learn about next?